Hello dear friends, welcome to PharmaGrid. Let's begin with today's KAPS recalls discussion. Question number 61. Which one of the following is not a progestin? The options are norethindrol, norethindrone, mestrenol and levonorgestrel. So here the correct answer is option C, that is mestrenol. We know that this estrogen and progesterone are steroid hormones that play an important role in regulating mammalian reproduction. They regulate the development and functioning of the uterus. Estrogen is responsible for regulating the menstrual cycle, while the progesterone is the hormone that supports pregnancy. Among these options, mestrenol is an estrogen commonly employed in several oral contraceptive products. So in this slide, we will discuss the classification of both estrogen as well as progesterone. So estrogens are subdivided into natural estrogens and synthetic estrogens. Natural estrogens include estradiol, estrone and estriol. Then synthetic estrogens are further subdivided into steroidal and non-steroidal. Steroidal estrogen examples include ethinyl estradiol, mestrenol and tibolone. Non-steroidal estrogens examples are diethyl stilbestrol, hexestrol and dinestrol. Then clomiphene citrate is an anti-estrogen. Then fulvestrant is a selective estrogen receptor downregulator. Then the selective estrogen receptor modulators include tamoxifen, toramifene, raloxifene, etc. Then aromatase inhibitors include letrozole, anastrozole and exemestane. Okay, so now coming to the classification of progestins. Progesterone derivatives include medroxyprogesterone acetate, megestrol acetate, dihydrogesterone, hydroxyprogesterone caproate and nomegestrol acetate. Then 19 nortestosterone derivatives. 19 nortestosterone derivatives means these kind of progestins have some androgenic activity due to the structural similarity to testosterone. Because of this, these kind of progesterones can cause acne as well as hirsutism. These 19 nortestosterone derivatives are further subdivided into esteranes and gonanes. Esteranes include norethindrone, also known as norethisterone, then linestrol, also known as ethinyl estrenol, then allyl estrenol. Gonanes include levonorgestrel, desogestrel, norgestimate and gestodin. Then mifepristone is an antiprogestin and ulipristol is a selective progestin receptor modulator. Next question. Which of the following antifungal agents is ineffective against Candida organisms? The options are miconazole, clotrimazole, cyclopyrox and tolnaftate. So in the question they have asked about the agent which is ineffective, which is not effective against Candida organisms. So here the correct answer is option D, that is tolnaftate. Although tolnaftate is effective against several types of fungi, it is ineffective against Candida organisms. This miconazole, clotrimazole and cyclopyrox are relatively broad spectrum antifungal agents with activity against some species of Candida. Question number 63. Antibiotic-induced pseudomembranous colitis is most commonly treated with. The options are metronidazole, loperamide, clindamycin and gentamicin. Here the correct answer is option A, that is metronidazole. Pseudomembranous colitis refers to swelling or inflammation of the large intestine, that is the colon, due to an overgrowth of Clostridium difficile bacteria. Then how this infection occurs? This infection is a common cause of diarrhea after antibiotic use. The good bacteria in your colon usually keep the amount of Clostridium difficile in your body under control. But antibiotics can kill the healthy bacteria and let this Clostridium difficile grow too fast. So this will damage your colon and causes pseudomembranous colitis. Then drugs causing pseudomembranous colitis include ampicillin, clindamycin, fluoroquinolones and cephalosporins. The treatment options for pseudomembranous colitis are metronidazole, which is the first line treatment option, then vancomycin and fidaxomicin. Now the treatment regimen for pseudomembranous colitis. Oral therapy with metronidazole 250 mg 4 times a day for 10 days is a recommended first line therapy. Vancomycin is also effective, but its use must be limited to decrease the development of vancomycin resistant organisms such as enterococci. Vancomycin 125 to 500 mg 4 times a day for 10 days should be limited to those who cannot tolerate or have not responded to metronidazole, or when metronidazole use is contraindicated, as in the first trimester of pregnancy. Next question. Patients receiving amiodarone should be monitored for the development of. The options are pulmonary toxicity, pseudomembranous enterocolitis, ptosis, and stasis dermatitis. Here the correct answer is option A, that is pulmonary toxicity. We know that amiodarone is an antiarrhythmic drug. It is a potassium channel blocker. So it is used in treating ventricular arrhythmias. It may cause a number of serious adverse effects including pulmonary fibrosis, neuropathy, hepatotoxicity, corneal deposits, optic neuritis, blue-gray skin discoloration, and hypo or hyperthyroidism. So baseline chest X-rays and pulmonary function studies should be performed before therapy begins. Question number 65. Which of the following conditions is commonly associated with an increase in alkaline phosphatase levels? The options are iron deficiency anemia, chronic obstructive pulmonary disease, osteoporosis, liver disease. Here the correct answer is option D, that is liver disease. This ALP is produced primarily in the liver and bones. Serum alkaline phosphatase levels are particularly sensitive to partial or mild biliary obstruction, either extrahepatic or intrahepatic, both of which cause levels to rise. Increased osteoblastic activity as occurs in Paget disease, hyperparathyroidism, osteomalacia and others also increases serum alkaline phosphatase levels. So with this question, we have completed today's recalls. Thank you for watching this video. Have a good day and let's see you in the next session.